said that now in states where abortion is illegal, now medical residents, OB residents, can't even be trained in how to treat miscarriage. That was a blatant lie. And it should have been corrected immediately. And it should have been corrected, honestly, by the pro-abortion physicians. They know better than that. They know, they're both practicing in states that have abortion restrictions. And I'm sure that their residents are still learning how to treat miscarriages.
Hello and welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, or AAPLOG. On this podcast, we bring on experts to provide insights that can help medical professionals in their life-affirming practice and their life-affirming career. I'm Miriam Diallo, AAPLOG's Communications Manager, and today I'm joined by my co-hosts, Dr. Christina Francis and Dr. Susan Bane, for a very special episode. Now on June 4th, so that's last week as of the time of this recording, Dr. Bane and I had the honor of seeing Dr. Francis testify as an expert witness before the U.S. Senate Committee on Health, Education, Labor, and Pensions, the HELP Committee. Dr. Bane was in the room with Dr. Francis, and I was watching the live stream from home. We're very grateful for the opportunity to defend life-affirming medicine before our nation's legislature, and today we thought we'd have Dr. Francis and Dr. Bane offer their thoughts on that hearing and some of the topics that were discussed. So ladies, thank you so much for being here today.
Thanks so much, Miriam. It's good to have all three of us together, especially to break down something I know a lot of people have a lot of questions about. So
I agree.
Thank you so much, ladies. Now let's just start with just a general question. How did you each feel being at that hearing? Dr. Francis, you were in the hot seat, and Dr. Bane, you were in the room with senators and witnesses.
Yeah, well, it was certainly an honor to be asked by Senator Cassidy and his staff to come and be one of the two pro-life witnesses there that day. I was blessed to be joined by Melissa Oden, who many of our listeners might be aware of her. She started the Abortion Survivors Network. So it was definitely an honor to be asked. A little bit intimidating, sitting in front of a bunch of U.S. senators, including Senator Bernie Sanders was the chair of the committee, and so it was a big committee to be in front of, and a little bit, we knew going into it that it was going to be imbalanced. So there were 4 pro-abortion witnesses and just 2 pro-life witnesses. So we went in fully prepared, and I have to say I'm so thankful for our team at AAPLOG. So many people were a part of helping just prepare things for that day. So it was definitely an honor to be there and an experience. It's my second time testifying in front of Congress. And for people listening who don't know how that goes, as a witness, you get your 5-minute opening statement, but then you don't get to speak again unless a senator asks you a question or gives you the floor to speak. So that can be somewhat frustrating, especially given some of the things that we heard that day, which we're going to talk about a little bit more today. But it truly was an honor. And for those of you who are friends, supporters, members of AAPLOG, I just want you to know that it was not about me being there that day. It was me being there representing all of you. And it really, truly was an honor to represent you that day in front of the Senate. So I don't know, Susan, what were your thoughts? You were sitting behind me, so I didn't get to see you the whole time. But
Yeah. I was such a proud member of AAPLOG that day, and recognizing the value of the voice of doctors, of healthcare professionals who practice life-affirming medicine, who practice Hippocratic medicine, who never directly and intentionally kill our patients. I just felt really proud, and you represented our organization and our over 7,000 members so well. It was a great day to be part of AAPLOG.
Thank you.
Absolutely. It was a great day for me to be a part of AAPLOG as well, just kind of watching from my computer. Dr. Francis, one question for you. What was one point that the pro-abortion witnesses brought up that stood out to you at this hearing?
Goodness. Well, there are a lot of things I think that as I was thinking about which I would answer there were many, many things that stood out, both as ludicrous, but also as sad to me, actually, that the witnesses. But I think I'll focus mostly on, there were two physicians who do abortions. It sounds like, at least at some point in their career, have done abortions well into the third trimester. They've been doing abortions their whole careers, that were testifying on behalf of the Democrats. And I think, one of the things that really stood out to me was just this picture that they painted of chaos in their hospitals, in the medical profession since the Dobbs decision. And, it really stood out to me. One of the things that was brought up by Dr. Linton, one of the witnesses, was in her testimony was, what about a woman with breast cancer who needs treatment? Or what about a woman who, has an infection from premature rupture of membranes? And all of these things that she brought up that made it sound like, now that they don't have induced abortion to go to, that they're like, what on earth are we supposed to do? And, I think what the thought that went through my head at that point was, for those of us, as Susan said, the 7,000 plus members that we represent, as well as many others across the country who have never done induced abortions as part of their practice, we know exactly what to do in those situations. We take care of our patients. And, I thought, well, there's a lot of breast cancer treatments actually that are available now for women who are pregnant, where they can continue their pregnancies, but also that all of these state laws that they were decrying actually fully allow for physicians to intervene immediately if a woman is facing a potentially life-threatening complication of her pregnancy. And, I don't want to assign motives to any of the physicians that were there. I don't know where this sense of chaos is coming for them. I don't know if they truly don't know how to take care of patients without induced abortion in these situations, or, I don't know. Again, I'm not going to assign motive, but what really stood out to me was, one, I was so thankful for my medical training, that I trained in a place where we did not rely on the crutch of induced abortion, that we actually learned how to really take care of our patients and take care of them well, and offer women alternatives to ending the lives of their children intentionally. And so that's really what stood out to me. And I just thought, well, they kind of kept saying, like, how are we supposed to know what to do? And there's all this chaos and people don't know what to do. And I wanted, if I'd been given the chance to speak at that point, I would have just said, just look at the way all of us practice. We can show you exactly how to take care of patients.
Absolutely. It's definitely unfortunate that this is a narrative that's being promoted so strongly, but it's definitely not an uncommon one. And so we're definitely happy to keep educating the public and also physicians as necessary about the fact that they can continue to provide excellent healthcare, even in pro-life states, without performing induced abortions. It's something that we're going to have to keep repeating, but obviously that's why we're here as an organization, is to offer that education. Dr. Bane, I want to echo that same question for you. What are some points that stood out to you from the pro-abortion witnesses at this hearing?
Yeah, that's a great question. And we'd have to do about 10 podcasts, I think, to cover everything. But I think the very first words that were spoken were by Senator Bernie Sanders, when he basically removed men, removed fathers, removed family from the conversation. He handed the mic to Senator Murray, a woman, basically because he feels like this is only a woman's decision, and it's only a woman's issue. And granted, it is a woman's issue, but it's also a family issue, and it's an issue for men too. I'm the medical director at 4 pregnancy centers. I see patients every day that I'm there with unplanned pregnancies, and it is a men's issue. And sometimes the men are there and sometimes they're not. But that made me sad that was the Democrats' perspective on families. I think I would echo Senator Cassidy's comments that as OBGYNs, we take care of 2 patients, a maternal and a fetal patient, and it became quite obvious from all the questioning from the Democrats and the responses from their witnesses that they do not believe that. They, the very first day I went on my third year rotation in medical school to OBGYN, I was told this is the most unique medical rotation you're going to have because you're going to care for two patients simultaneously, your maternal and your fetal patient. It was echoed when I began my internship in OBGYN as a resident physician. And everything we do in our jobs, except induced abortion, we're mindful of two patients, how we prescribe medications, when we ask, are you feeling your baby kick? When we monitor a woman during labor and perhaps have to do an emergency C-section because the baby's not tolerating labor, we acknowledge two patients, except that one time when we really give permission for a woman to tell us when we can acknowledge an embryo or a fetal patient. And that's tragic. And I think when we look at medical education moving forward and how residents are being trained, I really caution those of you who interact with medical students, those of you who nursing students, all the health professionals, is to continue emphasizing the fact that we care for both the maternal and the fetal patient. And I think the other big thing for me was I was pretty shocked when Dr. Linton and Dr. Verma did not state that there is nothing about the Dobbs opinion or any of the pro-life laws that prevent us from continuing to provide miscarriage care. There's not a state in this entire country where a woman who has a miscarriage, meaning the baby's already died of natural causes, an ectopic pregnancy, or a life-threatening situation, that she can't get care. And that was pre-Dobbs and is post-Dobbs. And they have a huge opportunity to clarify that, and they did not clarify that. And to me, that's disappointing. That I think the medical profession is failing our patients, is failing the public. And just the fact of the title of the hearing, and I don't have, actually I do have it, The Assault on Women's Freedom, How Abortion Bans Have Created a Healthcare Nightmare Across America. I think it was Dr. Francis, you said this during your written testimony, that it's not that has caused the chaos. Do you want to share what you said? Because I actually think that was a powerful statement about why do we have the chaos?
Yeah, absolutely. Well, as you said in my opening statement, I said that it's not these pro-life laws that have caused a nightmare for women's healthcare. It's the fact that for the last 50 years, we've told women that the only way that they can be successful or healthy is by ending the lives of their children. That's created a healthcare nightmare in this country. And now this intentional peddling of fear mongering and misinformation is adding to that nightmare. And I know we need to keep moving, Miriam, but one other thing I wanted to say, just bouncing off of what Susan just said, is the fact that I think it was actually one of the senators that brought it up, but said that now in states where abortion is illegal, now medical residents, OB residents, can't even be trained in how to treat miscarriage. That was a blatant lie. And it should have been corrected immediately. And it should have been corrected, honestly, by the pro-abortion physicians. They know better than that. They know, they're both practicing in states that have abortion restrictions. And I'm sure that their residents are still learning how to treat miscarriages. So they knew that wasn't true, and they let it stand. And to me, that was a huge miscarriage of the truth. Pun not intended there. Sorry about that. But yeah, I mean, and again, for those of you listening who are maybe thinking, well, Dr. Francis, why didn't you respond? Just as a reminder, you only get to respond when someone gives you the floor. And so, and so unfortunately, they kind of moved on after that. But that's why one of the reasons why we wanted to do this podcast is just so that we could clear up some of the lies that were told during that hearing.
Yeah, absolutely. And that's why I'm grateful to have you ladies both on to offer some clarifications and some responses that, didn't get time to address during the actual hearing. So yeah, this is all very helpful. A lot of really good points, you know, on the narrative surrounding fatherhood and the role of fathers might be inadvertently creating a situation where the men feel shut out in the name of kind of women's empowerment and making it solely a woman's decision. Well, actually, women need the support of their male partners in situations where they have unplanned pregnancies. And so these narratives where you make it just a woman's decision, that might inadvertently create a situation where men feel like they can't step in when in fact the very thing that a woman needs is for them to step in.
Well, Miriam, and I, before you get on to your next question, I really want to build on that because, you know, in the pregnancy centers, when we see these women, I will often ask when they're alone is, what does the father of the baby think? And the most common response I get is he says, it's up to me. I'll support you in whatever you do. And I'll say, well, what kind of support do you need from him? And they'll tell me, I wish he would tell me to keep the baby. I'd keep it if he wanted me to. And so, yes, we know that there is coercion that happens. Some men coerce women, but many of them, they're just absent because society, that's the message society has told them, is you have no voice in this. And that's exactly how this 2-hour hearing started, with Bernie Sanders handing the mic over and as a man, not taking ownership at all for empowering women.
Absolutely, absolutely. When we tell women it's your body and your choice, you know, a lot of women hear it's your problem, and we don't want any part in helping you through this situation. So yeah, it's unfortunate that this is something that this is the default narrative on you know, the role of men and women in unplanned pregnancies. And also you brought up great points about, you know, our central point, the central aspect of the philosophy of life-affirming healthcare is, you know, we have two patients, or physicians have two patients, pregnant women and their preborn children. That's something that really should have been brought up more. So, Dr. Francis, I'll direct these questions to you. I wanted to give you the chance to respond to one actually pretty inflammatory claim made by the chair of this hearing, Senator Patty Murray. She stated that AAPLOG does not want women to have access to birth control. And so I'll just ask a simple question. Is this true?
Well, I will give you a simple answer, and that simple answer is no, Miriam. So for anyone who watched the hearing, Senator Murray was the first to ask questions, and boy, she laid into me from the beginning, and it was all about contraception, but she made an assumption, a false assumption about AAPLOG as an organization, that we are against women having access to contraception. And so we wanted to take this opportunity to clarify, to correct the record on this, that AAPLOG is not against women having access to contraception. We are in support of women having fully informed consent about anything that they might be considering that's part of their health care. And so we have put out information that our members actually requested we put out about hormonal contraceptives, and about, you know, is there any chance they could have a post-fertilization effect? And honestly, for many of them, the research is inconclusive at this point, and we state that very clearly. So AAPLOG is, as an organization, does not take a position on contraception. We know that amongst our members, we have a variety of opinions about contraception, and you know, some of our members prescribe it, others don't. Some have a religious objection to contraception, and others don't. And we're here to represent all of our members, because we are united in the fact that we do not use death as a treatment modality, that we will never intentionally harm either of our patients, and that we support our patients having fully informed consent. And I think an important point to bring up, one of the reasons that she was asking me that question was because of a bill that was being introduced the next day called the Right to Contraception Act, which doesn't need to be introduced. Contraception access is not in jeopardy anywhere in this country. Even in states with very strong pro-life protections, contraception access is not at issue. And so really, this was a needless bill, but also many bills like this are actually removing removing physicians from the process of women getting contraception. And for any of us who have prescribed contraception, we understand these are not benign medications. I mean, women need to be seen in person. They need to be screened for a variety of things. And as I've often joked, when I would joke with my patients, for the OBs out there, over the years, pap smear guidelines have changed. And so now women don't need to have a pap smear every year. But I would always warn my patient, that doesn't mean you don't need to come see me every year, because you're more than just your cervix. You're more than just needing a pap smear. And now I feel like with the birth control issue, we're kind of in the same place. Women are more than just their need for birth control. And so there's a variety of reasons why they need to see a physician, including to discuss contraception. And so that was my answer to Senator Murray. Not really sure where she gets the idea that AAPLOG is against women having access to contraception. That's not a position that we have ever held as an organization.
Absolutely. That's really important to clarify. And yeah, a lot of a big aspect of that line of questioning was that she framed it as a yes or no question, and you did not buy into that framework, and you were fully in your right to do so, just because given the context, given what she meant by access to contraception, given the bill that she was forwarding at the time, the question was likely intended to pigeonhole you into a overly simplified framework, the political framework that she was forwarding. And so you gave a more nuanced response than she was happy with, but that's it was definitely the right thing to do, and it's a good thing to clarify now what our position actually is.
And Miriam, yeah, exactly. And I feel like I should add one more thing, that one thing that AAPLOG is opposed to is any physician or other medical professional or hospital ever being forced to dispense any kind of medication like a contraceptive that they have a moral or religious objection to. And so we do stand for conscience rights. And that's the other reason why we were not fans of that Right to Contraception Act, because it did appear to completely obliterate. There was no religious exemption as part of that bill. And so we do support conscience rights for physicians who choose not to dispense contraception. And so I do think that that's an important point to make as well.
Absolutely. Yeah, that's really important to add as well. One other question for you, Dr. Francis. Another thing that Senator Murray said that I wanted to give you the chance to respond to. I do have the quote here with me, so I'll just say, according to resources that were put out by your organization, that's what she said about us, quote, you recommend, you being AAPLOG, that in cases of dangerous pregnancy complications like a massive placental abruption, women should be forced to labor for 24 hours, even if that means being treated with blood transfusions in intensive care, and even if their pregnancy is non-viable in the first place, just so that they can deliver an intact fetus, end quote. What are your thoughts on that claim?
Well, it is 100% absurd. That's about the briefest way I can put my response to that claim. I'm not sure where she's getting that exact claim from. She later referenced a couple of things that sounded to me like they might have come from either our glossary of terms, which is very important document, or perhaps our practice guidelines on concluding pregnancy ethically. But it's very clear in both of those documents that while we advocate from an ethical standpoint, trying to deliver an intact baby for families, even if we know that that baby is not going to be able to survive because they're too early in gestational age, to assist with the grief process, we also recognize that there could theoretically be a time where that is not possible. And we certainly advocate for doing whatever is safest for the mother, but also taking into consideration the dignity of the preborn child, the fact that that preborn child, if he or she is still alive, can feel pain likely as early as 12 weeks in pregnancy. And so that has to play into our decision-making as ethical physicians. And so, we detail, and I have detailed before in podcasts that I've been in, stories about patients who did have a placental abruption, who we were able to support and allow them to have a normal delivery. Because honestly, many times when you're facing these very complex situations, a surgery may not be the best option for that patient either. I think sometimes people assume that surgery, a D&E at 20 weeks is very risky for the mother. It can be even more risky if she has certain risk factors that would make that procedure more risky for her. And so this is not the picture that she painted, first of all, was absurd. We are always taking into account the safety of our maternal patient as well. And, the one patient story that I can think of recounting on a podcast, she was a very complex patient. I was taking care of her in conjunction with our trauma surgeons, with our maternal fetal medicine specialists, and with at least one other of my partners, all of whom were in agreement on the course of action for her, and also had varying opinions on abortion, I will add. So, we chose this because it was what was at the time in our clinical judgment, the safest thing for mom. And by the way, that mom wanted an intact child to hold and to grieve. And so we were trying to take that into account as well. So Senator Murray painted a completely inaccurate picture of AAPLOG's position. She also, I think, probably pulled this from a hit piece that had been written by a journalist on AAPLOG, not from our own document. And so, my exhortation to Senator Murray and her staff would be to do better fact checking before making claims like that. But we did feel that we needed to correct the record because, as you said, Miriam, that was a very egregious claim against our organization, who is made up of board certified medical professionals who care for both of our patients and give our patients excellent and fully informed health care.
Absolutely. Thank you so much for that.
I want to just add to that. That was a moment where I really cringed and cringed extra hard because you didn't get to defend yourself given the framework and how those hearings work. So I'm so glad you have the opportunity to do today. And I was particularly glad that we were doing this podcast because if you recall, Dr. Francis, at the end of the hearing, Dr. Verma had one of the last words, and she basically called us out, you in particular, about that us not calling the situation you just described when we have to separate our maternal and fetal patient. She said it was political motive that we didn't call it an abortion, which to me makes me realize, A, they don't understand the definition of an induced abortion, and B, basic medical ethics. So an induced abortion is defined by the Center for Disease Control, so the CDC, as an intervention with the intention to terminate a suspected or ongoing pregnancy and does not result in a live birth. So your intention is to produce a dead baby. Well, that, when you were taking care of that patient with the bleeding, or we take care of a patient who has premature rupture of membranes, we're not intending by separating our maternal and fetal patient to end the life of our fetal patient. That may be an unintended consequence, but we're going to try to save the life of both of those patients if we can. And pre-Dobbs, they knew exactly that that was not an abortion either, yet they want to call it one after Dobbs. And that's part of the confusion that we have. And then in terms of the medical ethics, intention matters. That's a basic foundational principle. Think about the fact that, when we give medications of all sorts, let's just use chemotherapy as an example. If a doctor prescribes a chemotherapy agent, they know that there are going to be some harmful side effects, maybe hair loss, nausea, vomiting. Their intention of prescribing it is not to cause those. Right. That is an unintended consequence. Their intention is to kill those cancer cells and hopefully save the life of their patient. Same thing with us when we're prematurely separating a mom and a baby in a medical emergency. We're not intending the death of either one, but we know if we don't try to separate them, we'll likely end up with both our maternal and fetal patients dying. And so I was really taken aback that they don't understand some very basic definitions.
Right. Absolutely. Well, and just to add one more point onto that, Susan, I'm so glad you brought that up because I think, there's two things. First of all, they kept bringing up the fact that oftentimes when we need to intervene in these potentially life-threatening situations, that these are very wanted pregnancies. And not that wantedness determines value of that preborn child. But I guarantee you that, well, at least I would assume that those doctors, Dr. Verma and Dr. Linton, don't walk into the rooms of those patients and say, we need to do an abortion. Right. Because they understand inherently that that's not an abortion, but two, they understand how upsetting that would be to that patient. You know, what I usually say, and I would assume they say something similar, is, we need to get you delivered right now. I'm really sorry. I know you're early, but we don't have a choice. You know, we need to move towards delivery. And the other thing is that, you know, there was a survey that was done in 2018 in the journal Contraception that asked physicians if they performed abortions. They didn't say elective abortions. They didn't qualify. They just said abortions. 93% of private practice OBGYNs said that they did not. So physicians understand what abortion means, and they understand what's not an abortion, if they're being honest with themselves.
Amen.
Yeah. Right. Some really important points there. And I just want to say that I will have the original documents, the references in the show notes. So Senator Murray, we suspect, was trying to refer to our 10th practice guideline document. So I'll have that linked in the show notes, and then I'll also have our glossary of medical terms that we published last year. And then also on the point of birth control or hormonal birth control, I'll also have our 7th committee opinion attached in the show notes, just so you guys can see what our position on these topics really is. So yeah, as we move towards closing out, Dr. Francis, I just want to ask, is there anything else you didn't get the chance to say at this hearing, but would have liked to?
Well, yes, there are many things that I would like to have said. And actually, since you were just talking about show notes, one way that we can get more information to the committee is by submitting a written testimony as well. And so we submitted a multi-page written testimony, and I believe Miriam will link to that in the show notes as well, so that you all can read more. But I think one thing that I would be remiss if I didn't bring up was towards the end of the hearing. So earlier in the hearing, Senator Ted Budd from North Carolina had asked me about the amazing therapy that we can provide for women who regret their abortion decision when they started chemical abortion, of abortion pill reversal. And I was thankful that Senator Budd asked me about that so that I could talk about that, so that it's very important that people be educated on that. But then Dr. Verma brought up that she had in fact been part of a study with Dr. Mitchell Kreinen that looked at abortion pill reversal. And she made the outrageous claim when she was really, you know, supposed to be telling the truth to a congressional hearing, that the study was stopped early because abortion pill reversal was so dangerous for women. And she said, you know, of course, if this was a treatment that was proven, I would provide it for any patient who wanted it. This was so egregious to me, and it took everything in me not to get out of my seat, honestly, at that point, to correct the record. Because what she was knowingly hiding was that the study was stopped early because women who had received placebo ended up in the emergency room with life-threatening hemorrhage, had to have emergency surgery, one of whom had to have a blood transfusion. The women who actually got progesterone, which is the abortion pill reversal therapy, yes, one went to the emergency room, but she was just found to be completing her abortion, required no treatment whatsoever, and was sent home. And so actually the study that she was claiming shows that APR was not effective and is dangerous actually showed that APR was effective. Twice as many women in the progesterone group had ongoing pregnancies at 2 weeks as the women who received placebo. And it was the women who had received mifepristone and not progesterone that actually had the adverse outcomes. And that's why the study was stopped early. So, and any physician who has learned even the basics of how to read a study would be able to pull that from the data presented in that study. So that was a really egregious lie. And then the fact that she used that to accuse me of spreading misinformation and threaten my board certification because of that was just, I don't know, Susan. I don't have words to put to what that was, but that at the end of the hearing especially was something that I really wish that I could have addressed. Was, you know, I agree. Misinformation is very harmful, but I was not the one spreading misinformation. Everything that I said in that hearing was backed up by evidence. I had a binder full of studies to show them if they would have cared to ask about it. And people can see too, if you go to the written testimony, that everything that I say in the written testimony is backed up by peer-reviewed evidence and by our practice guidelines and committee opinions, which are also fully sourced and fully evidence-based.
Absolutely. And since you're talking about this, why don't I go ahead and also put the original 2020 study by Mitchell Crennan in the show notes as well, just so people can see what that study actually says. Dr. Bane, I'd also like to close out by asking you that a similar question. What's something you wish had been asked at that hearing?
Yeah, well, before I answer that, I just want to follow up on what Christina said. You know, I've taught undergraduates for about 12 years, and in a basic research methods conversation, I could give that study to undergraduates and they would be able to interpret it. It's so clear what the findings are. So the fact that Dr. Verma was involved in the study, from her words, it seemed like she was directly involved and drew the conclusion she drew should really bring caution to all of us that the loss of academic integrity in the research we do really probably scares me the most. As somebody who has an MD, PhD, and has gone through the process of learning how to do research and the pitfalls of when we bring our advocacy, our egos, our motivations other than truth into it, was definitely appalling at that moment. So yeah, I would echo what Dr. Francis said there. You know, for me, what I would have loved to have heard more about is the role that pregnancy centers, there are nearly 3,000 pregnancy centers across this country, what we do for women. We know that about 80% of the time, women state that socioeconomic barriers are the reason they choose abortion. And women will also say, remember the 80% number, 80% will say that if my circumstance was different, I wouldn't have chosen abortion. Well, pregnancy centers help change circumstances. And so many legislations across the country have done a really good job of acknowledging, when they write pro-life legislation, of bringing in provisions to really address socioeconomic barriers like quality and affordable daycare, workplaces that are family friendly, maternity leave, paternity leave, various things like that. The other aspect of pregnancy center work is that many have medical clinics in them, like the 4 that I oversee, where I see patients. And, you know, I thought about the witness Madison that the Democrats had brought. Madison, her story was really tragic, and she had an unplanned pregnancy, and it was tragic to me because she didn't get the opportunity to go to a pregnancy center, and she could have, but maybe didn't know about pregnancy centers. She was asked the question, how did you feel after you got your abortion? She had to travel out of state. And she said, it was the first time I actually slept. So most common thing women say immediately after an abortion is they experience relief. And then the reality of their situation comes in. We know there can be long-term mental health outcomes. But immediately, women feel like they're in a crisis. And she gave us her story, and she was in a crisis that whole time. And what pregnancy centers do when we give a fully informed consent to women and empower women is we help them get out of that fight or flight response so that when they make their decision of massive consequence, do I give birth and parent? Do I give birth and choose adoption? Or do I give permission for a healthcare professional to end the life of my baby through abortion? That they're in a place of calm. They're fully informed. They're not in survival mode, which you could just hear in her story she was in. So I had so much empathy for her, and I just would love the opportunity for pregnancy centers and the good work that gets done across this country to be highlighted more.
Absolutely.
Yeah, absolutely. The role of pregnancy resource centers in this massive issue of induced abortion, that's, that it's really important. And it really would have been nice if it had been touched on more, because organizations like yours, Susan, or Dr. Bane, they do offer some really important services, really essential for women who are in unplanned pregnancies. Ladies, thank you so much for coming on today to share all of your insights. It's been an honor to speak with you.
Absolutely. And thank you, Miriam, for putting this podcast together. We're so happy that we could get on here and get a little bit more time to, again, clarify some lies and misinformation that were told during that hearing. But also, I think, what I'm leaving this with is just how positive and how supportive life-affirming medicine, whether that be in with a physician or whether that be through a pregnancy center with medical services, Susan, like the ones that you work at, how positive and empowering and supportive that is for our patients. And that's really what we want people to understand.
I agree.
Absolutely. Thank you so much, ladies. And thank you as well to our audience for joining us today. If you like this episode, please don't hesitate to give us a like on YouTube and subscribe to our channel so you can keep getting these videos in your notifications. If you're listening on a podcast app, be sure to give us a 5-star review. That will really help us reach out to more people. And yeah, with all that being said, I'll see you next week for our next episode.